Thank you to all joining this audio visual class. Today I am going to tell you about different type of symptom. In last class I have told about the characteristic symptom, characteristic particular symptoms, local symptoms, general symptoms, so many varieties of symptoms. You can say that it is a myriad of symptoms because homeopathy based on symptomatology. But here we also to know which type of symptom, which type of symptom, which type of I have told about the myriads of symptoms because homeopathy based on symptomatology. There are different type of symptoms. So in evaluation, symptom is so important because there are common symptom, characteristic general, characteristic particular, characteristics individual. Individual means a person suffering individual character. So just like biting nail, it is an individual character, also peculiar. Today I am telling about what is the importance of pathological symptom. As a general, you already know that in diagnosis, the symptoms which are the diagnostic symptoms for the disease have no value in selection of remedy. No value. It is right. But Dr. Boger, when revised the Dr. Bonington Repertory, and he gave highly stress on the pathological symptom. Here, pathological symptoms are those that are the product of disease. But Boger says, I am not concerning for the particular pathology, disease pathology, but I concerned with the general pathology. As for example, keloid, warts, important for selection of disease because they explain the state of the patient. Warts, keloid, exotosis, tumor, fibroid, cyst. There are so many general pathology that developed and in the body, and that also helps in selection of remedy. So here, give first example, why not give importance to the pathological symptom? They represent the ultimates of disease. Pathology results the ultimate of disease, the product of disease. And they find expression in the local parts. Where disease symptom found? In the local part, your kidney disease, your liver disease, so local part. And they overwhelm the economy and refuses to let the organism give out finer symptom for selection. क्यों हम लोग कहते हैं ये कोई सिम्टम नहीं था, जनरल पैथोलॉजिकल सिम्टम, पार्टिकुलर का क्या पैथोलॉजी, लोकल है, कॉमन सिम्टम है. Also it helps us, they divert the attention of the examiner from more vital symptom. अगर आप पैथोलॉजिकल सिम्टम को देखेंगे तो आपको जो वाइटल सिम्टम है वो छूट जाएगा. जैसे एज फॉर एग्जाम्पल थर्स्ट in case of diabetes. It is a common symptom diabetes. Frequent urination in case of prostate, loss of appetite in case of jaundice. This is due to pathology. So we ignore there. हम वहाँ क्या करते हैं, इग्नोर करते हैं उसको, और उसमें अनकॉमन पेक्यूलियर खोजने की ढूंढ. अगर उस पर आ गए तो जनरल पर चले गए आप. उसके बाद नेक्स्ट है, few drugs have been pushed for enough in the proving to elicit such symptom. बहुत सारे ऐसे ड्रग हैं जो पैथोलॉजी प्रोड्यूस कर देते हैं. जैसे continuous use of digitalis, continuous use of continuous use of tuberculinum, continuous use of tuberculinum. Now, some pathological symptom helps us. As I have told you, warts that determine the constitution, that determine the miasm, and keloid, exotosis, it is defined the. So here Dr. Boger says that particular pathology are not important, but general pathology also helps in deciding the medicine. इसलिए बोगर बॉर्निंगसन जो बोला उनमें उन्होंने जनरल पैथोलॉजी को दिया। कैसे जनरल पैथोलॉजी? जैसे बताया ट्यूमर, वार्ट्स, किलोइड, है ना, ये सारे जनरल पैथोलॉजी। एज फॉर एग्जाम्पल जैसे एनासार्का। अब एनासार्का इज द प्रोडक्ट ऑफ डिजीज, बट इफ देयर इज किडनी इज नॉर्मल, liver is normal, and that time elasarca develop, that helps you in deciding the case. So now last point, few drugs have been pushed for enough in the proving to elicit some symptom. बहुत सारे ड्रग्स जो है इस तरह पैथोलॉजिकल सिम्टम प्रोड्यूस करते हैं जो बताया मैंने। लास्ट, यू हैव एट नो मीन्स ऑफ इंडिविजुअलाइजिंग दीज पैथोलॉजिकल चेंजेस इन द लिविंग ह्यूमन बीइंग। इसका कोई मतलब नहीं है जो पैथोलॉजिकल चेंज है उसको इंडिविजुअलाइज करें, अलग करें, इसका कोई मतलब नहीं है, क्योंकि दिस इज प्रोडक्ट ऑफ डिजीज। हमको क्या चाहिए? सिम्टम एज ए प्रॉपर। सो हियर you say that what the importance of pathological symptom in repertorization is the only general pathology important as per Dr. Boger. Thank you all.